Good morning, good afternoon, good evening, wherever you are in the world. My name is Ethel Richards, and I am the plant-based nutritionista, here to inspire you to take your health back one meal at a time by eating more plants. My personal mission is to live and teach others a life that honors the health and well-being of our bodies, our minds, and our emotions, emphasizing holistic nutritional health and overall health and wellness. I believe that we can both enjoy our food-based cultural norms and traditions that we love and enjoy so much, improve both our understanding of food and our relationship with food in a way that gives our bodies life, helps us to thrive, live our best lives, and add value to our well-being and quality of life, rather than subtract from it. And I believe we can do this in just two words: lifestyle changes. And that's what we're going to talk more about today. Well, we are still in the thick of the holiday eating season, and in this episode of In the Kitchen with the Plant-Based Nutritionista, we are going to focus on changing the narrative as it relates to preventing diseases of the heart that so often leads to heart attack and death in our community, and offer our listeners ways to improve their heart health outcomes. Dr. Don Rowe joins me in the kitchen to discuss having a healthy heart over the holiday season and for many years to come. Dr. Rowe was born in Montego Bay, Jamaica, and came to this country at a young age with his family growing up in Miami, Florida. He graduated valedictorian from Carroll City High School and accepted an academic scholarship for a combined Bachelor of Arts and Medical degree 7-year program with Fisk University and Meharry Medical College School of Medicine in Nashville, Tennessee. He graduated from Fisk University summa cum laude and was inducted into the Phi Beta Kappa Academic Medical Society. In medical school at Meharry during his junior year, Dr. Rowe was inducted and later named president of the Alpha Omega Alpha Academic Medical Society Gamma Chapter of Tennessee. He then went on to graduate from medical school at Meharry in the top 1% of his class. Dr. Rowe moved to Atlanta, Georgia, where he completed his internship, residency, and fellowship in cardiovascular diseases at Emory University School of Medicine. He was on the Emory faculty until 2014, holding numerous positions at Emory Johns Creek Hospital, including medical director of the Intermediate Cardiac Care Unit. Dr. Rowe holds board certifications in both internal medicine and cardiovascular diseases. He is very active in his community and church and has given several CME and didactic sessions to both the medical and non-medical communities. He was featured on CNN while at Emory during his residency and on local television in the more recent years while serving at Emory Johns Creek Hospital. Most recently at Emory Hillendale, Dr. Rowe served as the Chief of Medicine and Vice Chief of Cardiology, as well as on the Medical Executive Committee. Dr. Rowe continues to serve on their credentialing committee and maintains privileges at all Atlanta area hospitals. Dr. Rowe performs cardiac catheterizations, transesophageal echocardiograms, cardioversions, echocardiography, vascular ultrasound interpretation, nuclear and non-nuclear stress test interpretation, as well as consultative cardiology. His clinical interests include hypertensive heart disease, congestive heart failure, ischemic and peripheral vascular disease diagnosis, and management. Dr. Rowe enjoys spending time with his family, which includes his beautiful wife, their 2 daughters, and twin boys. He also enjoys landscaping projects and being involved with several church and community events. Dr. Rowe, thank you so much for being here today.
Oh, thank you. It's a privilege to be here and to share some information that can hopefully save at least one life tonight.
We'll go with it. And so I'm so glad you said that. I want to start with your September interview you did with Rolling Out. You quoted something that I thought was so powerful. You said that your brother calls you when you guys talk. He asks you 2 important questions. Do you want to tell our audience what those questions are? And we'll use that as our check-in for you today.
Yeah. So he'll say to me, hey, how was your day today? And almost before I can answer, he said, did you take time to take care of yourself today? And really, by the time I could muster the words to respond, he says, Don, always remember the grave is waiting on all of us. In other words, don't be in a race to the grave, because that's where we're all heading eventually. But to take the time to really take care of yourself, right? You just want to slow down this race of life to the point that you could get up in age in a healthy fashion, with your faculty still in place, and most importantly, your cardiovascular health intact, since we already know heart disease is the #1 cause of death.
Absolutely. And so let's check in with you. What did you do today to take care of yourself?
Yeah. So I'm a massive runner, so I run essentially every day. And it's just important to engage in cardiovascular exercise. The guidelines really outline at least 30 minutes a day. It describes most days out of the week, which is interpreted as 5 to 7 days out of the week. It's really important. If you think about this, 24 hours in a day, I mean, I think we all, no matter what we're doing, can find 30 minutes to commit to invest in ourselves. I mean, it's sort of like going to a bank. What I mean by that is you pull up at the teller and they ask you for your ID, and you say, oh, I want to withdraw $1,000, for example. Well, they're not going to give you $1,000 just because your hair is well done and that you're smiling, or if you have a tie on and just look well groomed. That's not the criteria to get the $1,000. The criteria is that they identify that you are who you say you are, and then when they check your account, they see at least $1,000 in there. In other words, if there was no deposit, don't expect a return. And it's no different with our health. If you don't invest, there will be no return.
Ooh, well, man, that is truth to power right there. And I feel like I want to jump right into the idea that many think they don't have time to move their bodies throughout the day. I was just doing research yesterday and came across several articles that affirm the average American, specifically what we are calling millennial and Gen Z, spend about 3.5 hours on their phones.
Wow.
3.5 hours in the apps or in the emails, but we're using our phones. And I'm assuming the assumption of this research is that it's unproductive use. Like we're not using it to work, but just scrolling through apps, commenting, things like that. How do we balance, Dr. Rowe, and you as a practicing physician, helping people see the value in slowing down enough to say it's important for me to take 30 to 45 minutes to move my body?
Yeah, this is an important question. Yeah, there's an absolute pandemic, frankly, almost of cancerous proportions with the addiction to phones. Most people that's on the phone, they're really just minding other people's business. It's not really promoting a business. It's not really getting ahead in life. It's not making them any wiser. It's not resulting in more figures in their bank account, nor is it really resulting in more degrees. It's just a lot of time wasting. And so when I really think about this thing, one thing I am certain of, every single one of us is running out of time. And the last thing we want to do is waste time. And so if something is not allowing you to advance academically, socially, spiritually, it's all garbage and you shouldn't do it.
Wow, that can't say anything else to that. That is 100% true. 100% true. Excuse me. If we're not doing things that advance our purpose, what are we doing?
What are we doing? Wasting time.
Wasting time, right? And you just told us, and through your brother, we shouldn't be rushing to the grave. We're going to get there eventually, but let's take our time.
Take our time. Walk as slow as possible.
Yes. So tell us, let's not take for granted that everybody knows what a cardiologist is. What is a cardiologist, and how is general cardiology different from your specialty as an invasive cardiologist?
Right. So a cardiologist is one that has spent many years, at least 6 years actually, after medical school to learn the cardiovascular system. That includes the wiring of the heart, so arrhythmia management, the pumping function of the heart, for example, congestive heart failure, the blood supply to the heart, specifically referring to ischemic heart disease. We also learn quite a bit about management of such in multiple age ranges, typically from the age of 17 years old all the way up to death, so 100 plus, etc. And our job is the diagnosis, management, and prognostication of heart disease, meaning that once you identify a patient, even if they're in the best of health, your job is to keep it that way for them, so to maintain their cardiovascular status. And then also there's something called secondary prevention. So when a person has already suffered a heart attack or stroke, for example, you prevent the next event. Tertiary is really saying that, okay, the person's maybe already had a stroke when they came to see as a new patient, and now you're trying to prevent death and recurrence of another stroke, for example. So it's just really important to not only aggressive about early detection and management, but also to help the patient understand that they're a partner in their healthcare. You want to live, you have to do what it takes to live. You can't expect to be eating fried foods all day long, eating pizza at 11 at night, waking up at 3 in the morning and having Lay's chips, etc., and think somehow your cholesterol is going to be normal, your blood pressure is going to be normal, and somehow you're going to lose weight by doing such things. So it's all about the discipline. And right back to what we said before, we don't want to be in a race to the grave, and poor decisions about our intake, our food intake, will result in a hastened trip to the grave.
Ooh. And that, I just want to skip to this next question because you touched on it a little bit when you were throwing out ages. Can you talk about the shift when typically when we think about heart disease, we're thinking older people or allegedly a disease of aging, so to speak. Really, it's a disease of lifestyle. But what are you seeing now with our younger children that are turning up with heart disease earlier on? And can you talk to us about what that leading indicator is as it relates to things like being over fat or overweight?
Yeah, no, this is a wonderful question because the great majority of heart disease doesn't start acutely. What I mean is that there's an underlying disease process that was manifesting over time. And by the time there's an event, there's already been a sort of, for lack of a better word, a buildup of the process. In other words, when you see a person with a heart attack at 45 years old, usually it's not because plaque developed overnight, right? This may have started as early as the teenage years, right? With the nonstop fast food eating, the more sedentary lifestyle. You know, growing up, people used to be outside and riding their bicycles. Now you go on subdivisions, you don't hear a word. You could hear a pin drop. No one is outside anymore. Everybody's just watching TV and playing video games. So there's less activity. There's also more access to really bad food. If you really think about what's going on in this country, usually the food that's the cheapest is the worst for you. Right? You know, you go get a salad from a certain store and it may be $12, $13. And if you dare put 2 shrimp on it, it may be $25. Versus you go to certain places, drive through, by the time you give your order, you go around to the other window. That's maybe 30 seconds. And then you're handing you a bag of what they said is a burger. You know, you just got to think to yourself, man, what is that exactly that was ready in 30 seconds of me ordering it? And, back to my example about going to the bank. Truthfully, garbage in is garbage out.
Yeah.
So fast food, that's a way of quickly dying.
Ooh, yes. And we're seeing that in this epidemic, if you will, of obesity in our children because they are more sedentary and they're eating lots of processed foods, whether it comes from the supermarket or it comes from their local fast food chain. What can you say to parents? Mm-hmm.
Yeah, exactly right. And I was going to answer exactly what you were asking. So we're thinking about the same thing. So it turns out it's sort of a cyclical process. So first of all, you have the parents working nonstop, 2, 3 jobs. So they're running around to provide for the family because the cost of living is just more expensive no matter where you go.
Yeah.
Certain daycares, for example, maybe $1,200 to $1,500 a month per child. So you're working harder. That means there's less time to cook, right? So you're always on the go. So you pick up your kids, you're going through someone's drive-through. By the time you get home, sometimes 8, 9 p.m. So they're eating bad food to begin with, eating the bad food late. And then it's a vicious cycle of doing that over and over and over for years. And then suddenly, many are wondering, why was there a heart attack in their 40s? Well, again, a process started, say, 20 years before that. You know, my wife is a pediatrician, and she's told me that she's seeing, even in her day-to-day practice, that folks are becoming larger and larger at a younger age. I mean, we're seeing, she's describing obesity sometimes as early as 8, 9 years old. So think about it. If that starts at 8, 9 years old, by the time you're 20 years old, you're talking about 11 to 12 years of the body being under attack by excess salt and sugar. So that's why it makes sense that we're seeing people at younger ages with the devastating consequences of heart attack, kidney failure, stroke, etc., and the complications of unchecked cardiovascular disease.
Yeah, I just read a study that talked about how the clinical manifestations of, let's say, like diabetes, if you will, as a result of this extra weight in the kids, it's more critical. It's just magnified, and so that they're less likely to live longer because they've been dealing with this for so long versus the adult who gets an onset at 50 or 60. You're talking about a kid who's having this progressive disorder now for 30, 40 years.
Right.
It's scary.
And I also believe that the same inflammatory process, almost wonder, I think about this often, that we're seeing more and more issues with infertility. And you just wonder, the inflammatory process of the excess sugar and salt and just the stress of running around in this country. I just wonder if the same process that ultimately leads to cardiovascular disease is not part of the same process that even leads to things like infertility issues, for example.
Oh man, so there was a study about that I was recently reading that made a connection between diet and fertility.
Yes.
So when I talk about eating more plants, I'm really talking about, the reality that God designed our bodies to thrive off of things that are alive, not off of things that are, dead and processed and things like that. So thank you for sharing that. And I think I would love to have your wife on too, to talk to our parents about, ways we can better support our children. I actually have a podcast coming out in a couple of weeks on the power of meal prep. And hopefully dispelling the myth that there isn't enough time, but like you said, it requires discipline and it requires intentionality. So I think we already hit on how someone even gets to the point where they have a heart attack, but tell us, what is a heart attack, and can you help us understand the science behind it for someone who doesn't even know what that means?
Sure. No, thank you. So what we've learned over the years, and we've continued to learn more and more and more, that really heart disease is an inflammatory process. And what ends up happening is that plaque forms at an early age. And when it forms in the arteries, on the lining of the walls inside the artery, what it does is basically assaults the artery, meaning that plaque disrupts the layer of the artery. And with time, it's almost like a small ulcer being formed over and over, healing, rehealing, healing, rehealing. And with time, that plaque sets in even deeper into the deeper layers of the artery to the point that it ruptures. And that rupture is what leads to blood clots and a lot of inflammatory cells in the artery, which then disallows blood flow. And then when there's starvation of oxygen to the heart, that's where all the chest pain starts. And that's the culminating heart attack. Really and truly, that process is essentially the same for those that have what's called ischemic stroke. So the same process in the heart arteries, frankly, could happen in any artery. We just call it a heart attack because it's the artery supplying the heart. But it's no different than a, quote, brain attack when a person's having a stroke. So the same process. What are those processes? What are the risk factors? So obesity, for sure, we know is correlative. We know about hypertension, high blood pressure. We know already about diabetes and the inflammatory process of glucose excess. We also know about things like drug abuse, for example, cocaine abuse, excess of alcohol. All these things can not only aggravate the body overall, but specifically the heart as well. The body's really an amazing place, but we always have to remember we're only going to get one. It's truly our only true investment. Everything else is not really an investment. It's fleeting.
Thank you for that. And I'm sure our viewers now have a better understanding of what a heart attack is. And you actually said some of the very things Dr. Paul King said when he was talking about stroke. And so I think this is just confirmation and reinforcement to our listeners who are trying to better understand the science behind how their body operates. So could you tell us, this is the week of Kwanzaa, New Year's Eve is coming up this weekend where people are going to be gathering and partying. What are some of the signs and symptoms that we can look for as we're gathering with our loved ones to recognize someone could potentially be having a heart attack?
Right. And this is another good question. And it really varies from male to female and age, for example. Perfect example. If you have a patient that has diabetes, their symptoms may be completely different than one without diabetes. Why is that? Well, diabetes, the hyperglycemia, the bathing of the vessels in excess glucose really affects nerves in addition to the arteries, particularly with the nerves. It really minimizes the classic symptoms of, say, chest pain, for example. Diabetic patients may just feel short of breath, or what we call exertional fatigue. So their usual activity, they're so exhausted. I had a patient many years ago where she just felt so exhausted to exercise, and she thought it was because she was working 3 jobs. Well, she ended up needing multi-vessel bypass surgery after we figured out there was a blockage in every major artery of the heart. So what I'm saying is that women's symptoms are different from men. Diabetes also changes the type of symptoms one may have, whether it's the usual classic chest pain to that of shortness of breath, exertional fatigue. Sometimes, believe it or not, patients have no symptoms at all. It represents less than 10% of patients, but we're seeing more and more where patients have no symptoms. They just happen to get an EKG done, checked by their primary care physician, or checked for a different reason, say work screening, for example, and it looks like they've had a whole heart attack in the past. And then we subsequently do further testing, whether it's a stress test, a picture of the heart, or echo, just different tests. And come to find out there's a wall not moving or there's reduced blood flow. That leads to the things I do, which is a heart catheterization, or the invasive cardiologist does. And sure enough, we'll find blockages and they need bypass or stents. So diabetes and gender definitely affect what's happening.
So let's lean into this. Is heart attack or heart disease preventable? And if so, how so?
Yeah, so the majority, and that's what's frustrating about the diagnosis, that the majority of heart disease is preventable. It's really about lifestyle choices. The excess of everything. So the excess of fried food, the excess of bad food, the late night eating, the excess of weight. Excess is what leads to this inflammatory process and it culminates into a heart attack or stroke. So if I could leave a word, discipline is really what's needed to stay alive.
Wow. Well, I think there it is. So I guess I'll close on this note. Have you noticed, maybe two notes, as a physician, as a medical doctor, that the answer to preventing and remediating most illnesses and diseases begins with the following statement: live a healthy lifestyle, eat whole fruits and vegetables, avoid processed foods and sugars, and remain physically active to keep not only a healthy heart, but our cholesterol and blood sugar levels favorable or optimal levels.
Yes. And right, and in addition, it's really important. Folks are so stressed out these days. We've seen more stress, at least in my lifetime. I've never seen people so stressed out. This even started before the pandemic. It just became even more heightened during the pandemic. And stress by itself is an inflammatory process, which absolutely increases the risk of bad things happening. Stroke, heart attack. In fact, extra stress alone can lead to weight gain by the excess of cortisol being produced in our bodies. So I think all of us just need to take a deep breath and pace ourselves. And again, not being a race to the grave.
I love that. So to our listeners today who may have loved ones that came to mind, or maybe even saw themselves as we were speaking, what practical advice can you offer them to draw a line in the sand? And I said, that's it. Today, I'm going to do what I need to do to prevent or reverse any of my risk factors for heart disease.
Yeah, it really goes back to one of my favorite Bible verses, Ecclesiastes 9:4. One interpretation puts it this way. It says, a live mouse is better than a dead lion. And so you got to want to live. And if you want to live, you have to invest. Without investment, there will be no return. Always remember that prevention is way cheaper than the cure.
Well, there it is. Dr. Don Rowe, thank you so much for sharing your insights and your expertise with our listeners. You have definitely spoken truth to power, and we appreciate you for taking time out of your day to spend with us in my kitchen, chatting about how we can have a healthy heart over the holidays and beyond. Thank you, Dr. Rowe.
Absolutely. No. It's a privilege. Thank you so much for the opportunity to share some information. Thank you.
You're welcome.